ADHD. ADHD, or Attention Deficit/Hyperactivity Disorder, is a condition that affects how the brain regulates focus, impulses, and energy. It is linked to a part of the brain called the prefrontal cortex, which is responsible for planning, decision-making, and self-control. People with ADHD may struggle to stay focused, organize tasks, remember details, or sit still for long periods of time. The symptoms usually begin in childhood, and while they often become less noticeable in adulthood, they can continue throughout life. Many people think ADHD means you can't concentrate on anything, but that's not true. In fact, someone with ADHD can become hyper-focused on something they find interesting, spending hours on it and completely losing track of time. The real challenge is that the brain doesn't always choose what to pay attention to. Boring or repetitive tasks can feel incredibly difficult to start, even when they're important. ADHD can affect school, work, relationships, and everyday life. Depression. Depression is a mental health condition that affects your mood, thoughts, energy, and everyday life. It can feel as if all the color has been drained from the world around you. Depression affects the brain's balance of chemicals such as serotonin and dopamine, which play important roles in motivation, pleasure, and emotional well-being. When these systems aren't working properly, even simple tasks can feel overwhelming. While everyone feels sad from time to time, depression is much deeper and lasts much longer. Thoughts may become slower, making decisions can feel exhausting, and even getting out of bed may feel like climbing a mountain. Some people sleep all day, while others lie awake all night. Many withdraw from friends and family not because they want to be alone, but because pretending to be okay takes more energy than they have left. Depression doesn't always have a clear cause, and it can affect anyone, regardless of age or background. Although it has often been misunderstood throughout history, research has shown that depression is a real medical condition that affects both the mind and the body. PTSD. Post-traumatic stress disorder, commonly known as PTSD, is a condition that can develop after someone experiences or witnesses a deeply frightening or traumatic event. This could include accidents, violence, natural disasters, war, abuse, or other forms of trauma. PTSD happens when the brain becomes stuck in survival mode after a traumatic experience. A traumatic event can change the way the brain processes fear and safety. Normally, once the danger has passed, the nervous system calms down and the memory is stored as something from the past. With PTSD, that process doesn't work the same way. The brain continues to react as if the trauma is still happening, even when the person is safe. Treatment can help people process their experiences and regain a sense of safety. Bipolar disorder. Bipolar disorder is a mental health condition that causes significant changes in mood, energy, and activity levels. It involves two main mood states, mania and depression. During a manic episode, the brain can become filled with intense energy and confidence that may almost feel superhuman. A person may sleep very little but still wake up full of ideas and energy. Their thoughts race, they speak quickly, and they may feel capable of anything. After a manic episode, a severe emotional crash can follow. The high energy disappears and is replaced by a period of depression, where everything can feel heavy and meaningless. Getting out of bed may become incredibly difficult, and things that once felt easy can suddenly seem impossible. The contrast between these two states can make the depression feel even more intense because the person remembers what it felt like to have so much energy. Bipolar disorder is different from ordinary mood swings because these changes are much stronger, last much longer, and can seriously affect a person's daily life. OCD. OCD, or Obsessive-Compulsive Disorder, is a condition where the brain becomes trapped in a cycle of unwanted thoughts and overwhelming urges to perform certain actions. A person may become stuck on a fear, an image, or a frightening what-if scenario that the brain simply can't let go of. These thoughts can feel so real and urgent that the brain demands some kind of action to reduce the anxiety. This is where compulsions come in. A person might wash their hands so often that their skin becomes damaged, check the door lock over and over before leaving the house, arrange objects in a perfect order, or silently repeat certain words or phrases to themselves. With the right treatment and support, many people with OCD learn to manage their symptoms and regain control of their daily lives. Anxiety disorders. Anxiety disorders happen when normal worry turns into a constant alarm system that never fully switches off. The brain may begin treating ordinary situations as if they were dangerous, causing the body to release stress hormones even when there's no real threat. Anxiety itself is a natural response. Everyone worries sometimes about exams, money, relationships, or the future. But with an anxiety disorder, the worry becomes excessive and can spread into almost every part of life. People may constantly worry about things that haven't happened and may never happen. Even simple decisions can feel overwhelming because every choice seems like it could lead to disaster. Should I send that message? What if they misunderstand me? What if they're angry? Anxiety disorders can also cause physical symptoms such as a racing heartbeat, muscle tension, trouble sleeping, and difficulty concentrating. Eating disorders. Eating disorders are serious mental health conditions that affect eating habits, body image, and a person's relationship with food. The most common types are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa involves severely restricting food intake because of an intense fear of gaining weight. Even when a person is dangerously underweight, they may still see themselves as overweight. Bulimia nervosa works differently. A person may eat large amounts of food in a short period of time and feel that they've lost control. Afterwards, feelings of guilt and anxiety can lead them to try to compensate by making themselves vomit, exercising excessively, or using other unhealthy behaviors. Binge eating disorder also involves repeated episodes of eating unusually large amounts of food in a short period of time. However, unlike bulimia, these episodes are not followed by behaviors meant to compensate. Eating disorders can affect physical health, relationships, and everyday life, and they can affect people of any age, gender, or background. Autism. Autism is a neurodevelopmental condition that affects how a person communicates, learns, interacts with others, and experiences the world around them. Autistic people may find it difficult to interpret social cues, understand body language or facial expressions, maintain eye contact, or take part in conversations in the way others expect. This doesn't mean they aren't interested in other people. It simply means that social communication works differently for them. Because autism exists on a spectrum, it affects everyone differently. Some people need significant support in their daily lives, while others live independently and require much less support. Every autistic person has their own strengths, challenges, and unique way of thinking. Autism is not a disease that needs to be cured. It is a different way for the brain to develop and function. With the right support, understanding, and accommodations, autistic people can thrive and live meaningful, fulfilling lives. That's it for today's video. I hope you found it helpful. If you enjoyed it, don't forget to like, subscribe, and share this video with someone who might find it useful. And once you've subscribed, make sure to turn on the notification bell so you never miss a future video. If you have any questions, feedback, thoughts, or suggestions for future videos, leave them in the comments below. I'd love to hear from you. Thanks so much for watching, and I'll see you in the next video.